Hey everyone, this lesson is on non-alcoholic fatty liver disease, NAFLD, and the influence of diet on non-alcoholic fatty liver disease. So we're going to talk about different types of diets and how they may actually lead to improvements or reduce the risk of actually getting non-alcoholic fatty liver disease. But we'll first talk about what non-alcoholic fatty liver disease is. It is a liver disease that is not caused by ethanol or alcohol use. And it's characterized by fatty infiltration of the liver. So that is non-alcoholic fatty liver disease. And its etiology is mostly related to insulin resistance. So as insulin resistance becomes worse, we see more and more fatty infiltration of the liver, leading to inflammation of the liver and eventual liver disease. So individuals who have non-alcoholic fatty liver disease can either be asymptomatic, or they can have vague symptoms. And these symptoms can include malaise and fatigue, so they can be very tired, and they can have pain in the right upper quadrant. And it's usually a dull discomfort. So the right upper quadrant would be on the right side. So we're looking at a patient directly on, but this is the right side here, and it's in the upper area. So right upper quadrant, and it's a dull discomfort. So they might have something like that. Now, the typical treatment for non-alcoholic fatty liver disease is weight loss, and it's usually targeted for 0.5 to 1 kilogram per day with a goal of losing at least 10% of body weight. So that is the usual treatment for non-alcoholic fatty liver disease. And it's also important to avoid ethanol use as well. So that was a quick rundown of what non-alcoholic fatty liver disease is. And if you want more information, I have an entire lesson on this topic. But for the purpose of this lesson, we're talking about diet specifically and its role in non-alcoholic fatty liver disease. So there's actually been evidence demonstrating that certain diets and supplements lead to improvement of NAFLD, and we're going to talk about those in the next few slides. But before we get into some of the diets that improve NAFLD, let's talk about some of the dietary selections that are associated with actually getting non-alcoholic fatty liver disease. So these come from the paper entitled Higher Adherence to Plant-Based Diets are Associated with Lower Likelihood of Fatty Liver. So we're going to talk about this paper a little later on, but there are a few key points noted in this paper that I want to talk about. So there's actually been some reports indicating that patients with NAFLD consume diets consisting of the following. So these dietary selections are associated with actually getting non-alcoholic fatty liver disease or having a higher risk of getting it. And these include increased saturated fatty acids, and it's oftentimes from fatty meats and dairy products, certain dairy products. So high fat content dairy products are more likely. So an increased consumption of saturated fatty acids is associated with non-alcoholic fatty liver disease. And then there's also an association with increased consumption of carbohydrates. So these are the types of dietary selections that are associated with an increased risk of having NAFLD. So now that we know that, let's move on and look at coffee consumption. So in the review entitled Coffee and Non-Alcoholic Fatty Liver Disease, Brewing Evidence for Hepatoprotection, it's been shown that coffee consumption is associated with a reduced risk of cirrhosis, so the end stage of liver disease. And with regards to non-alcoholic fatty liver disease, several studies have shown that coffee consumption mediates the following. Coffee has been shown to mildly reduce the incidence of non-alcoholic fatty liver disease. Increased coffee consumption is associated with reduced non-alcoholic fatty liver disease grade, and increased coffee consumption is also associated with a reduced stage of fibrosis from NAFLD. So all of these are very important. It reduces the incidence of NAFLD, but also if a patient does already have NAFLD, it may protect from the progression of non-alcoholic fatty liver disease. And these beneficial outcomes seem to occur in a dose-dependent manner. So it's recommended that at least 3 cups of coffee per day is consumed to actually improve outcomes with regards to non-alcoholic fatty liver disease. So the next dietary selection or supplement we're going to talk about is vitamin E. And the following results come from this article entitled Effect of Mediterranean Diet and Antioxidant Formulation in Non-Alcoholic Fatty Liver Disease, a randomized study. So this is vitamin E. This is alpha tocopherol. There are other vitamin E's, but this is the one we're talking about here. And it's important to recognize that in non-alcoholic fatty liver disease, there is oxidative stress and inflammation. So antioxidants are very important. Antioxidants scavenge free radicals, including reactive oxygen species, or ROS. And the reason I mention this is because vitamin E is an antioxidant, and it's been demonstrated to have the following beneficial effects in non-alcoholic fatty liver disease, including reduced hepatic oxidative stress damage, reduced hepatic inflammation. So hepatic means liver, so reduced liver inflammation, reduced hepatic fibrosis, and these can also be found when studies combine vitamin E with vitamin C. So very important here, vitamin E supplementation, because vitamin E is an antioxidant, and we have oxidative stress and inflammation in non-alcoholic fatty liver disease, vitamin E supplementation has been shown to reduce hepatic or liver oxidative stress damage, reduce hepatic inflammation, and reduce hepatic fibrosis. So all very important. So what are some of the dietary sources of vitamin E? Where can you actually get vitamin E in your diet? So some dietary sources include nuts and seeds, vegetable oils, and some green leafy vegetables. So these are the sources of vitamin E. And the typical quoted vitamin E supplementation in non-alcoholic fatty liver disease is 800 units. And it's used particularly when there's actually hepatic inflammation. So when the liver has been inflamed or is currently inflamed, vitamin E can be used at that time. So 800 units of vitamin E. So the next vitamin we're going to talk about with regards to non-alcoholic fatty liver disease is vitamin D. So the information presented here is from the paper entitled Vitamin D Supplementation and Non-Alcoholic Fatty Liver Disease, Present and Future. So this is vitamin D calcitriol. Now there has been an association between vitamin D deficiency and higher incidence of non-alcoholic fatty liver disease. So as vitamin D levels go down, the incidence of non-alcoholic fatty liver disease goes up, and particularly the degree of steatosis, or the degree of fatty infiltration of the liver. However, evidence has been controversial. Some findings don't support this and some do. Now, one randomized control trial in children demonstrated improvement in the non-alcoholic fatty liver disease activity score with vitamin D 800 international units in combination with docosahexaenoic acid, DHA, 500 milligrams per day. So there may be some evidence to support vitamin D supplementation in reducing the risk of non-alcoholic fatty liver disease. So what are some of the sources of vitamin D? Some of them include meat and fish, dairy products like milk that have been fortified with vitamin D, and also vitamin D supplementation. The next type of diet we're going to talk about is plant-based diets. So this comes from the article entitled Higher Adherence to Plant-Based Diets Are Associated with Lower Likelihood of Fatty Liver. So many vegetarian diets are abundant in antioxidants and abundant in anti-inflammatory compounds known as phytochemicals. We've talked about the importance of antioxidants in reducing the oxidative stress damage in non-alcoholic fatty liver disease when we talked about vitamin E. So this was a cross-sectional study looking at 3 different versions of plant-based diets. And they ranked these diets from healthy to non-healthy according to the dietary selection of each. So in the healthy category, fruits, vegetables, whole grains, legumes, and vegetable oils were in the healthy group. And in the less healthy or unhealthy, it was fruit juices and other sweetened beverages, potatoes, and refined grains. And what they found was that a higher adherence to more healthy plant-based diets is associated with a lower incidence of non-alcoholic fatty liver disease and lower measurements of liver inflammation. So the healthier plant-based options, fruits, vegetables, whole grains, legumes, vegetable oils, over the other types of less healthy alternatives, fruit juices, potatoes, and those types of dietary selections. The next type of diet we're going to talk about is the Mediterranean diet. So this comes from the article entitled Mediterranean Diet and Multi-Ingredient-Based Interventions for the Management of Non-Alcoholic Fatty Liver Disease. So the Mediterranean diet contains high levels of antioxidants and fiber and avoidance of simple sugar. So what we've seen so far in this lesson, it looks like Mediterranean diets should be a very good option for non-alcoholic fatty liver disease. And in fact, with regards to other medical conditions, Mediterranean diets have been shown to improve metabolic syndrome, obesity, and type 2 diabetes. Mediterranean diets have been associated with the following in non-alcoholic fatty liver disease: a decreased incidence of non-alcoholic fatty liver disease, decreased severity of non-alcoholic fatty liver disease, reduction in body weight, and reduced liver enzymes. So reduced evidence of liver inflammation. So all very important. and a lower degree of steatosis, so a lower degree of fatty infiltration of the liver. So the Mediterranean diet, very good for non-alcoholic fatty liver disease and other types of medical conditions as well. The next diet we're going to talk about is the ketogenic diet. So this comes from the review article entitled Low Carbohydrate Ketogenic Diets, Glucose Homeostasis, and Non-Alcoholic Fatty Liver Disease. So ketogenic diet is a high-fat, low-carbohydrate diet, and the carbohydrates are less than 50 grams per day in order to attain ketosis. So there's actually been some mixed evidence with regards to ketogenic diet on liver health and functioning. Some evidence that ketone bodies reduce liver or hepatic inflammation. Now, some of the mixed evidence seems to be due to the type of ketogenic diet that is used. So either high-fat ketogenic diet versus very low carbohydrate ketogenic diet. So with regards to the differences between these two, both of these ketogenic diets have a low carbohydrate level, so less than 50 grams per day. But with the high-fat ketogenic diet, the caloric intake or the amount of fats that can be consumed, there's no limit to it. With regards to the very low carbohydrate ketogenic diet, there is. So the evidence I'm going to present here is from high-fat ketogenic diets, and that's where we see the most significant evidence or significant improvements in non-alcoholic fatty liver disease. So potential benefits of the ketogenic diet, especially the high-fat ketogenic diet, include weight loss, decreased evidence of liver inflammation, decreased triglyceride content in the liver, and particularly when it's a Mediterranean and high-fat ketogenic diet, very good evidence for improvement. However, there may be some potential risks of worsening or inducing non-alcoholic fatty liver disease with ketogenic diets, and that comes from this case report entitled Ketogenic Diet Induced Elevated Cholesterol, Elevated Liver Enzymes, and Potential Non-Alcoholic Fatty Liver Disease. So although there is some evidence supporting ketogenic diet in improving non-alcoholic fatty liver disease and outcomes of non-alcoholic fatty liver disease, there is some risk that there may be possible worsening of the non-alcoholic fatty liver disease. But again, it could be due to the type of ketogenic diet that is used. So I hope you found this lesson helpful and informative. If you did, please consider liking, subscribing, and clicking the notification bell to help support the channel and stay up to date on future lessons. Thank you so much for watching, and I hope to see you next time.